Hello, my dear friends. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, we are going to discuss the fourth cranial nerve, short and quick, also called as the trochlear nerve. So, this is a whole list of headings under which you should always attempt a cranial nerve answer. Okay, I'm not going to read it. You can pause and note this down. So, what is fourth cranial nerve? Fourth cranial nerve is one of the three important nerves that give motor supply to the muscles of eyeball. It's also called as the trochlear nerve. Externally, it is having a dorsal attachment to the midbrain at the level of inferior colliculus. What is its origin? So, the origin of trochlear nerve should be discussed under deep origin and superficial origin. When I say deep, I mean the nucleus. When I say superficial, I mean the external attachment on the brainstem. So let's talk about the deep attachment. So what nucleus gives rise to your trochlear nerve? The trochlear nerve nucleus. Take a look. This is a section through the midbrain. This is the aqueduct of Sylvius. This is the periaqueductal gray. And here is your trochlear nerve nucleus. Fibers of trochlear nerve go on to supply superior oblique muscle of eyeball, which actually is developmentally comes from preotic myotomes. And therefore, the functional component of trochlear nerve nucleus is general somatic efferent. So now, this is your trochlear nerve nucleus. See how the nerve emerges out, passes through the periaqueductal gray dorsally. See, this is anterior, this is posterior. It emerges dorsally, winds around the midbrain and comes out. Similarly, the opposite side winds around the midbrain and emerges out, decussating completely dorsally. Okay, so the points we have to note here is there is a complete decussation and there is a dorsal emergence from brainstem. So you can see it emerging here from below the inferior colliculus on either side of the frenulum veli, winds forward finally around the midbrain to come forward. So this is a whole lot of, theory about how the fourth cranial nerve passes, but we are not going to read it. Why? Because we can use image to understand this much better and much faster. So this is your midbrain. This is your trochlear nerve nucleus. That's the trochlear nerve. Superior cerebellar artery, posterior cerebral artery, cavernous sinus, superior orbital fissure, ring of Zinn. These are broadly the anatomical landmarks you need to know. Now let's follow the trochlear nerve. That's the trochlear nerve traveling dorsally, winding around the midbrain, coming forwards, passing between the superior cerebellar artery and the posterior cerebral artery, along the lateral wall of cavernous sinus, through the superior orbital fissure, lateral to the ring of Zinn. Okay, the image is giving you the whole anatomy. You don't need to know the whole theory there. Okay, now what happens? Now it emerges from the superior orbital fissure to enter into the orbit, where it goes on to supply the superior oblique muscle. SO4, superior oblique muscle. Okay, so that's the course of your trochlear nerve. Now let's talk about what kind of connections does it have. It receives impulses from the cerebral cortex of same and the opposite side. It also is connected to superior colliculus and the medial longitudinal fasciculus, both of which help to maintain the balance as well as to maintain coordinated movements of the head, neck and body during various movements. So when you move your body, when your eyes move in coordination with that body movement. Why? Because there are these tracks which connect them to your eye. Okay, that's why you have to have your trochlear nerve connected to the track so that when your body moves, your eyes do not lag behind somewhere. They also move in coordination while maintaining body's equilibrium. So let's talk about 4 peculiarities of trochlear nerve. It's the longest intracranial cord. Isn't it amazing that we've never really thought about it? But a nerve that will emerge dorsally will obviously have the longest intracranial course. Smallest cranial nerve. Okay, so in terms of number of axons, it's the smallest cranial nerve and it's also the longest cranial nerve. It has a dorsal exit which is unique. No other cranial nerve emerges dorsally. And it's the only cranial nerve to undergo complete decussation before emerging from the brainstem. The trochlear nerve therefore innervates the contralateral side. Note that when it emerges out from the right side, but it crosses over and supplies the left side superior oblique. So it has a contralateral innervation. So now what happens if it is injured or if it shows a lesion? So what does superior oblique do? Superior oblique brings about depression, abduction and intorsion of eyeball. Therefore, if you have a fourth nerve lesion, basically patient is comfortable looking forwards, but when the patient attempts to depress the eyeball, patient is very uncomfortable and often begins to suffer from diplopia. Remember, the muscle eyeball affected is that of the opposite side, not the same side because of the decussation. So, patient when he attempts to look at an object, patient experiences diplopia. To know more about midbrain itself, remember there are videos released on YouTube titled Midbrain at the Level of Inferior Colliculus Part 1 and Part 2. So if you want to explore midbrain itself, please feel free to go and study these videos on YouTube under VB Anatomy. Thank you, students. I hope this quick video helped you to study the fourth cranial nerve, and I'll see you in my next cranial nerve lecture. Bye.